very important pediatric disease that sometimes is very confusing to be able to distinguish between them. So I call them strawberry tongue and fever. Kawasaki. This is a vasculitis. That means so vasculitis, inflammation of the vessel. So this is litis, infection, and then the vessel. So inflammation, you have an inflammation of the vessel. And then the vessels that are involved usually is the small to medial, small to medial vessels. So every vessel in your body can be affected if they are very small and medial. And the number one that they attack is the coronary arteries, unfortunately. And this is the arteries that usually supply blood to your heart. So there's a couple of them. We don't need to know who they are, but they supply blood to the heart. You see, the blood is a vascular. It's a muscular organ. It pumps the blood, but it also needs some blood to be able to function. And that's how people get heart attack. Just because the heart has blood doesn't mean it doesn't depend on the blood it's pumping. So there's vessels that supply the heart itself, and sometimes they can also have disease. Unfortunately, these Kawasaki attack these coronary arteries. Those are the ones they attack really badly, and it become a problem. They usually happen after a viral infection. Okay, so after a viral infection, that's when it happened. It's very common in 1 to 5 years, kids in 1 to 5 years. So this is really, really young kids suffering from this really brutal problem. Basically, they may have cardiac issues because of this disease. So usually very young, 1 to 5 years, and they will get they will have this problem and it become a really bad. There's a couple of stages of the disease. So this is just a brief summary. So there's acute phase. The acute phase is very important, and that's what they like asking in your test. They need to have fever for like over 5 days. So if you have fever 1, 2, 3 days, it's not enough to diagnose you with Kawasaki. You have to have fever, high fever for over 5 days, 5 days and above. It can go up to like 39 degrees. So this is really, really 39 degrees Celsius. This is really high fever for a long time, for 5 days. And they have specific symptoms. I will show you how to remember them. I put them here, TCREAMS. So I'll show you how to break it down. So they will have bilateral conjunctivitis. So bilateral conjunctivitis of both eyes. So these are all the vessels, the small tiny vessels in the eye is being affected. So both vessels in the eye, and they will develop conjunctivitis. And then this will be followed by the lymph node in their neck. Okay, lymphadenopathy, cervical lymphadenopathy. So this will be also swollen, and they can get bigger, sometimes up to like greater than 1.5 centimeters. I don't know if they will ask you guys, but their lymph node is not tiny lymph nodes, huge lymph nodes. And their hands and feet all swells up. So hand, feet, edema. What they don't like is their mouth. Okay, their tongue. If this is the tongue, you have like it look like strawberry, really red, beefy red tongue. So strawberry tongue. Because of that, they cannot eat. They can't drink anything. And look at it, high fever, and then strawberry tongue, and they are mucosa. So you can call it mucositis or inflamed. That will lead to like something we call chapped lips. So chapped lips. So they have cracked lips, like somebody who is dry. It's all because of this high fever. The tongue is so big, and then they can drink, and their mouth lining, that's the mucosa, is also irritated, and they can't do anything about it. So they can't eat. And the classic thing is they get a rash from their head down. So they get a rash from their head and it start going down on their body. So if this is the kid, so they have rash all over. Every portion of the body has rash. So they also have rash. And it become a problem, the rash start going down. So this is the acute phase. So they have fever has to be more than 5 days. It has to be high fever, 39. They have to have bilateral conjunctivitis. Some lymph nodes has to get bigger, more than 1.5 centimeters. Their hand and feet, they need to have edema there. And then the strawberry tongue and their mouth itself is all red, mucositis. So these are classic symptoms in the acute phase. Okay. And that's what they like to ask you guys a lot in a SATA question. Okay. In a subacute phase, that means after after 1 week, this usually occur like 2 to 4 weeks. So after like 1 week to 2 weeks, they have undergone through all this 2 to 4 weeks. The skin rash, they have like severe rash. This rash will start to peel off. So peeling of the skin, peeling off the skin. That's why they get dry. Now it's like a burn wound. They get a burn of their body, and the skin can peel off. So if you see some books or in your test, they will say desquamization. I know squamous cells usually are the cells that form portion of your skin. So desquamization, basically, you're peeling the skin off from them, and then they can develop this aneurysm. This is what kills them. Okay, this is the problem. This is the red flag right there. Coronary aneurysm in the subacute phase. So after a week, they have had fever, rash, tongue, they couldn't eat and everything. Then they develop aneurysm 2 to 4 weeks. The coronary artery will develop aneurysm from the vasculitis. That's the inflammation. And this is the priority. If you see that, see this patient. Or this is why Kawasaki patients are always a priority, because they have cardiac aneurysm. Okay, cardiac aneurysm. Depending on how they frame the question, if it has something to do with the heart, I'm choosing that as a priority. And so they can get a heart attack from it. So any heart symptoms in your test on the Kawasaki patient is a priority. So they can get an MI, coronary heart disease, and then aneurysm, and then descromization, basically the skin peeling off. Then 4 to 8 weeks later, that's when everything resolved. So it take a while. The fever goes down, the skin start healing, and so you got to watch them for the aneurysm. So we go back to see if we can remember the symptoms. In your SATA question, there's specific things they can ask you. So I named the symptoms. These symptoms are listed. I put in an acronym as TCREAMS. Okay, TCREAMS, because of the rash, they need some cream, and the fluid loss from the rash. And since they cannot drink anything, well, you got to protect the skin so that you protect it from being a burn wound. They don't lose too much water. So I call it TCREAMS. TCREAMS for Kawasaki. So T is the temperature. So they have to have temperature, which is the fever. Okay, TCREAMS. And then they have to have bilateral conjunctivitis. Okay. And then the rash that starts from the head to the toe. Okay. And then the swelling of the feet. Okay, so they have edema, feet and the hands. And then the rash also, the rash is red, erythema-like rash. And I told you they have like lymph node in their neck, about 1.5 centimeters. So severe adenopathy, which is lymph node, cervical adenopathy. So 1.5, greater than 1.5. And finally, their mouth, okay, mucositis, so they cannot eat. And this is how you can remember signs and symptoms of a patient with Kawasaki. TCREAMS, easy to remember: temperature, conjunctivitis, rash, edema or erythema, adenopathy, or mucositis. And this is where the strawberry tongue comes from. We get a strawberry tongue. So you can put a strawberry tongue. TCREAMS, it doesn't sound good. So, but I left the strawberry tongue because it's very, it's specific. So you can remember that. This one is a little bit confusing. So you can. So strawberry tongue, but like I said, they have chapped lips, dry lips. But all this can fall under mucositis, basically. So that is um, the way to remember them. How do you treat them? Very important. And that's what you should expect that they're going to ask you. A, a kid coming with Kawasaki disease, so how do you treat them? Well, the, we can see that they have high fever, they cannot drink anything, they, the mouth is all swollen, they have strawberry tongue. So dehydration is their problem. So they need some fluid, hydration. You need to give them some fluid. But the main treatment, this is because this they can give you application questions. So that's why I listed so that you know that this patient are dehydrated. But the main treatment is they need something to take care of the inflammation. So they get an aspirin. So aspirin is ASA. That's the symbol. So this will help with the inflammation to bring the temperature down. And you can tell that I know you'll be saying, why is a 1 to 5 year old getting aspirin for a viral disease? Yes, this is the only disease process that a patient who had a viral disease will get aspirin. It's very important because you have Kawasaki disease, and that's very good in treating the immune response to that. So aspirin, they get an aspirin. And then they get immunoglobulin. Immunoglobulin is basically um, their albumin form of the proteins, basically, and to fight the antibodies that the body is reacting to. The body is reacting abnormally to the viral infection. It's the delay infection of the viral symptoms, and then that causes the vasculitis. And so, what is happening is um, you need the immunoglobulin to prevent the vasculitis. Basically, we don't know what causes it, but we think it's a viral. There's a viral element of it, but it's never. Nobody proved it, but there's evidence of antibodies being produced by your body reacting to something abnormally. So we give them immunoglobulin to help with that. So aspirin, immunoglobulin, and hydration. Those are the main treatment for that. So we'll take care of each of them. There's key things they can ask you. So when they go, the couple of teaching that they can they can ask you. So first of all, teaching, okay, can cause a problem in the kid. And if you give a kid aspirin for suspected URI symptoms, they can develop Reye syndrome. So you see how this is all interconnected, and then and so they can ask you a question. Somebody with the Kawasaki disease, all of a sudden, he came in with the following symptoms. They will start having fever, okay, and then they're lethargic, and then they have encephalopathy. These are the three major symptoms. This encephalopathy can lead to acute change in mental status, and they can go into coma or have seizure. And somebody will say, so why is this happening? Well, Reye syndrome is severe liver injury, acute onset of liver injury. And so you have this fever and they become lethargic. Why? Because the liver is responsible for breaking down urea that will turn into ammonia. High level of ammonia that is left, that is what leads to this encephalopathy, lethargy, and acute change in mental status. So a kid giving an aspirin, any aspirin derivative, it's not just aspirin. They will not tell you an aspirin. They will tell you aspirin derivative. So they'll give you some medication that have aspirin, salicylic acid in it. They won't say acid, but they'll give you salicylic acid. Anything that has salicylic acid in it can act like aspirin, and it can cause this Reye syndrome, fever, lethargy, encephalopathy, change in mental status, coma, and seizure. And so you should avoid this as much as possible. So, but I know somebody will ask, so why are we giving them the aspirin? Well, the coronary artery disease, so the aneurysm that will happen from the coronary disease is worse than them developing Reye syndrome. The Reye syndrome usually doesn't happen right away if you watch them carefully. But this one, they're going to develop coronary artery aneurysm that can rupture, that can kill them very shortly. So the risks and benefits, the benefit outweigh the risk. So this is more better than the encephalopathy. So that's why we still give them aspirin. So that is the teaching point. So the mother need to know to watch the kids about it. The next one is the immunoglobulin. Okay, I told you there's few things you have to know about it. They can ask you about. So the kid is usually, I told you there's autoimmune effect of it. So they give them immunoglobulin to help with the inflammation. Remember, the aspirin plus the immunoglobulin is what prevents. It prevents the aneurysm formation. That's why they're very important. You want to prevent the aneurysm. Usually this will resolve in 4 to 6 weeks. So to prevent the aneurysm, they need the aspirin and the immunoglobulin. Unfortunately, immunoglobulin is protein. Okay, so what does the protein do? Like albumin, if somebody is dehydrated, you give them albumin. Albumins like to suck fluid. It's too big to come out from the cells and then go into the intravascular space. So you stay in the you stay in the intravascular space, and it can't go into the extravascular. So it can't go out. So it stay inside your vascular system, intravascular, and pull water into itself. So this is water, you pull water out of the extracellular. So you pull the water out as extracellular. So you have more water in the intracellular space now because of the albumin. from the immunoglobulin. So what do you think? Now they're pulling water into the intravascular space. They have edema and all those things. They're pulling all the fluid into the blood. Guess what? All this go to the heart, back to the heart. So the blood goes to the heart. All the fluid will go to the heart, and it creates heart failure. So they will have the heart failure. So you have to watch them for that. So that's if they give you a question and some of the complication in the treatment, we're already talking about Reye syndrome. The other complication they will get from the treatment is from the immunoglobulin that can put them into heart failure because it's pulling all the fluid into the intravascular space. And so they are fluid overloaded now, fluid overloaded. So you want to prevent that. The other one sometimes is people forget is that immunoglobulin can give you some immune effect. It can decrease the immune system, okay, a little bit. So they become immunocompromised. Therefore, these kids, they are due for vaccination, but they can't get it. So no live vaccine, no live vaccination for patient who's getting immunoglobulin. So like they cannot get a varicella vaccine and they cannot get an MMR. So if they due for that at that age, you got to wait for at least 6 months so that they can recover from it. So no varicella vaccination, no measles, mumps, and rubella. You got to hold on to that. Those are live vaccines. This one, the oral form of polio, so OPV, is also a live vaccine. Then I don't think they will be ready for that time. Then influenza, the flu vaccine, the nasal form. I'm just listing them there in case you have another question that they ask you that you got to know certain few live vaccine. The varicella, measles, mumps, rubella, oral form of polio, and then influenza vaccine. The nasal form, the one, not the injection one, the Subacute one, no, IM one. This one is the nasal one is a live vaccine. So you got to watch that and make sure the patient doesn't they don't receive that if they're on immunoglobulin. So that is the key fact about the disease. In terms of teaching, when the kid get discharged home, the number one priority, okay, kid had the disease, he did well, sent home. When they go home, mommy has to look for fever for 24 to 48 hours. So like they have to up to like sometimes 72 hours. They have to check fever, keep on checking it. So they check it like every 6 hours, monitoring the kids nonstop. It's like a nurse at home, monitoring the kid nonstop every 6 hours for 48 hours because they have a high risk of recurrence. You don't want that. The more they have recurrence, the more they have aneurysm. So you want the fever to resolve. Signs of fever is equal to aneurysm. So if they keep on having more fever, then the vessel become more vascularized and then it develop into aneurysm. So you want to avoid that as much as possible. You don't want to hear it, but recently in one of the journals from England, they said COVID is a high risk of Kawasaki disease. So we are all doomed, especially the kids. So there's a high risk of Kawasaki disease from COVID, from the immune response of the I can't explain it, nobody. We're still learning COVID, but those are the few things I just want to share with you on that. Okay. So don't forget TCREAMS Kawasaki for SATA question, temperature greater than 29, conjunctivitis, rash, edema, erythema, and node, anterior cervical nodes, and mucositis, where they have the strawberry tongue. Fever has to be more than 5 days. Okay. Priority treatment is aspirin and immunoglobulin. Each of them has its own effect. Aspirin, you get Reye syndrome from it. So you got to be able to recognize it. Immunoglobulin, they can get, they cannot get a live vaccine from it. Okay. And then they can go into heart failure. So heart failure from the fluid shift. The kid temperature need to be monitored at home. When they continue to have temperature, well, they developing aneurysm. If they ask you, patient with Kawasaki, what do? You listen to the to make sure they don't have a mama. Your every priority function or question on this patient, your answer choice has to be a coronary artery disease, aneurysm, or fever after discharge. That's all. Sometimes they will ask you this. So how would you know they have developed aneurysm or they have CHF? You get an echocardiogram to evaluate them. But this is everything about Kawasaki in terms of teaching, treatment, management, and diagnosis. So we're going to talk about is the other friends. They're all the same. They sound the same. They do the same. Scarlet Fever. Day 2 is another one. Scarlet Fever. This one, we know the specific organism. So strep A, okay? So streptococcal cause the problem. So they have like URI symptoms. So they have strep throat, so sore throat or pharyngitis, right? Day 2, they have a fever. Fever is a little bit high, but it's not higher than that. And it lasts long throughout the disease process. Day 2, their mouth is in trouble. Okay, so we have like tonsillitis. Their tongue also have strawberry tongue. That's right. Day 2 have strawberry tongue. But remember, the fever is the key. Day 2 have cervical anterior lymphadenopathy. You see how they look the same. So the lymph nodes are also the same. So they have sore throat, they also have fever, they also have mucositis, they have strawberry tongue, huge tongue, they have lymph node in their neck, and then they have rash over their body, okay? But their rash is different, it's sandpaper. So be careful in your answer choice. It's a sandpaper rash they're talking about. Scarlet. Their rash doesn't peel like that of Kawasaki. So these are little features. So these are in a SATA question when it says sandpaper rash in a patient who has high fever. Yeah, they're talking about scarlet fever. Okay, how do you diagnose it? We already said it. So I told you about the organism. It's a strep. So you do a rapid strep to make the diagnosis. Then they can do final culture to do that. And this is why we have been misusing penicillin in the past because it's an infection. So most people, when they have sore throat, they want to give their kid antibiotics yet. So either use penicillin or amoxicillin. Those are the treatment. Antibiotic, for a couple of days, sometimes 7 days. Okay, so that's the classic symptoms of scarlet fever. So they have fever, they have rash also. Specific rash is a sandpaper. It's very characteristic. If you see how sandpaper look, there's some areas that is smooth, some areas that is rough here. Sandpaper rash. They have lymph node in their neck. They too, they have strawberry tongue. You expect them not to drink anything, not want to eat, but you have to hydrate them. And they have mucositis and a fever and a sore throat. Is a contagious as the same as the other disease. So you got to know what kind of what kind of precaution that you should take. So if I may probably had that to when we at the end of it, and we can talk about it. Had some fundamentals to that. So that's treatment to give them antibiotic, penicillin, or amoxicillin. Well, there's education you can give that I see, and they are always SATA question, risk factors and education factors. So what would they ask you? Well, mommy want to know when the kid can go to work, can go to school. Okay, so they can after after the treatment of the antibiotic, yeah, then they can go back. So they can go back after the antibiotic. They have to make sure they complete the antibiotic therapy, and then they are hydrating. So hydration, antibiotic therapy, and then they can go to school when they finish the antibiotic. Sometimes if the answer choice say yeah 24 to 48 hours after they have started the antibiotic, yes, they don't need to completely finish. So they can they can they can they can start they can go back after like 2 days after antibiotic. The rash, like I said, is the same thing. It start from the neck. This one start from the neck and you go all the way to the body. So they too they have rash. So it's hard to distinguish. Look for the key thing, sandpaper rash, which start from the neck and go down. The rest of the all is a little bit hard, sore throat, but you know the organism is strep. Unlike scarlet, it's not strep. So that's the scarlet fever. And this is his friend, the all fevers, rheumatic fever. So the same organism that caused the problem, strep A, it causes scarlet fever is the same thing that called rheumatic fever. And then it's upper URI symptoms, so they get a sore throat. They have fever, okay? After 2 to 3 weeks, the problem, the initial sore throat, they will develop high fever. And they may have a heart murmur. Or renal failure. Not true failure, but glomerulonephritis. So they will start peeing tea-colored urine. And this is the immune response. This is the delay response to the bacteria. Your body is now reacting to the bacteria that is causing the fever. The kidney is in trouble, and then your heart also is in trouble. But that's the kids. These are young kids. They're responding to that. So there's specific organs this is going to affect. So it's a sore throat that get resolved is caused by strep A. Then 2 to 3 weeks later, boom, they start having fever. They start having kidney issues, start having heart issue. The heart, they have what we call, they affect the mitral valve on the left side. So the mitral valve will be affected. So they have the valvular disease. So you have like a regurgitation or stenosis of the mitral valve. So that's you hear a murmur when you listen to them. So that's why everybody's afraid of this disease just by strep throat, and all of the sudden you have a cardiac problem and you have a renal problem. Okay, there is a way you can remember the symptoms. Okay, and I call it Jones. And then Jones, the O is the heart. I put it as the heart, and then no. So Jones. Rheumatic fever is Jones. Okay, so the J is they have joint problem. It's from the deposit of the antibodies against the bacteria get deposited into the joint, and they have joint problems. So like arthritis of these young kids, but it's migratory. That means it's moving. Today is on your knee, tomorrow is on the other knee, tomorrow on your hand. So it's migratory arthritis. Okay. And of course, you know this is the cardiac. So they are the valvular disease from the mitral valve here. Mitral valve is the common. So M, mitral valve, is what is affected in patients with rheumatic fever. And then they have skin nodules, like bumps on their skin. So the N is nodules. And the E is the erythema. Okay. A little bit of rash on their skin, like the same thing like the other one. And this is the very interesting phenomenon, Sydenham Corey. It's like they're doing break dance, like in Michael Jackson, dancing and doing breaks. Yeah, Sydenham Corey, rheumatic fever, they have joint problems. So this is a SATA question. Joint problem, heart problem. Heart problem is mitral valve. They have skin nodules, they have erythema, and it's sedon chorea. And so you see that. So that's what you have. These are the symptoms of rheumatic fever. Okay. In case they give you a lab work, because it's an inflammation, you should see like a ESR elevated. I've seen a question like that before. You see the ESR elevated, and that is normal with the disease process because of the inflammation. And then the heart problem will cause their PR interval to prolong. So this is long. PR interval is long. So this is key fact about rheumatic fever. Of course, everybody is worried about it. So you know the treatment is the same thing as the scarlet fever. It's the same organism, strep. So they need antibiotic, penicillin derivatives. So penicillin or amoxicillin or augmentin can do that. So that's scarlet fever. Rheumatic fever. You see, we do not talk about sandpaper like rash. No, the key thing is the kid had sore throat from the strep, and then 2 to 3 weeks later, boom, he has Jones syndrome. So he has Jones syndrome. You want to prevent Jones by looking for it. If you see a certain question and say a kid has strep throat, and then all of a sudden it's peeing, tea-colored urine, and some fever and edema, that's glomerulonephritis, and that's the kidney portion. I told you it affect the kidney, the heart, and the fever. So I believe the Jones is the most serious compared to the glomerulonephritis. That will resolve very soon. Jones is really bad. And the chorea, the Sedona chorea, when you see them, it's very sad. The kid is walking and doing break dance, walking around. So that is that. The last portion is the mother. You got to teach them. Always when you're studying for your test, please, please, please try to find something about every topic. What do I tell the mother? What do I tell the kids? Because they need teaching. That is our job. And that's what is going to be in your SATA, teaching intervention, okay? And so we teach them that complete the antibiotic. You don't want that to finish, because then they will get recurrent disease, which is bad. So finish all the antibiotic. If it's 20 days, 20 days, you finish. Usually it's like 5 to 7 days. The one thing that you have to tell them is toothbrush. Okay, the kid brushes with their teeth, but then the bacteria stay on top of the toothbrush, and so they get infected all the time. So after you start the antibiotic, so if the kid started, you had antibiotic the first dose, the following day, they shouldn't use the same antibiotic in a toothbrush anymore. They need a new one. So get a new one for them as soon as you start the antibiotic, so that it prevent reinfection. When do they go to school? The same thing. So they go to school 24 hours after they start the antibiotic. Like I told you, the other one, they can wait until they finish the other one, by usually 24 to 48 hours when they started the antibiotic. So if you start antibiotic 24 to 48 hours, they can go back to school right away while they're completing their therapy. So that is all the three disease process, strawberry tongue and fever family.